The best for a beach day, but if you're getting out on the water, it's important to note that Public Health Madison in Dane County doesn't start testing the quality of it until after the holiday weekend. New at 10, Grace Hodak has you covered on how that testing is done and what to look out for on the water in the meantime.
Beach season hasn't officially started for staff at Public Health Madison in Dane County.
We start our season after Memorial Day weekend.
But once it does, they'll be out every week.
Our staff will sample all the beaches that we are assigned to monitor and collect samples, bring them back to the lab here, and then test them for bacteria.
Jennifer Brown is an environmental health scientist with PHMDC. She says the way they test for bacteria in the lakes is very similar to an at-home COVID test.
We would have a big sample of our beach water, and then we would take a small amount for this test. That would get drawn up and put through the filter so it takes out if there was any large particles.
Brown says staff can usually point out blue-green algae just by looking at it, though they test it anyway to see what the toxin level is. She says what isn't visible is E. coli.
Sometimes the water looks nice, it looks clean, and there's still high E. coli for some reason. If the water is very choppy and you can't see through to the bottom at all, you can't see your feet in the water, that often means that there's a lot of movement going on and that can stir up bacteria.
Brown says bacteria can come from things like geese droppings and runoff after heavy rainfall. If you come in contact with it, she says you could experience symptoms like irritated skin and an upset stomach.
But we also want to make sure that even once it looks clear that there's no remaining toxin in the water. So we will test for that, and once that's below the limit, we will reopen.
Reporting in Madison, I'm Grace Hodak.